Welcome to Your Health Matters. I'm your host, Temesia Tuicaumia, and tonight we have Dr. Sheetal Singh, who works at the St. Giles Hospital, who's here to share with us about her work, what they do in community, and what you at home can be learning from her. Dr. Sheetal Singh, how are you?
I'm very good. Thank you for having us here.
Yeah, thank you for coming. How are you feeling? How's 2025 going for the...
It started on a very busy note.
Yeah.
But it's going through fine.
Yeah. Oh, that's good to hear. Well, thank you so much for also taking the time and coming in. We had one of your colleagues represent the Ministry of Health, the headquarters, and she was talking about positive mental health. And I think for our viewers, St. Giles Hospital can sometimes have a very negative perspective for a lot of people. They're like, oh no, what is that place? Oh, it has a stigma. Do you mind just sharing with us, and just breaking the stigma on the work you do? And also, how long have you been working at the hospital? And what's it like breaking the stigma?
So to begin with, I have been working for St. Giles Hospital for almost 7 years.
Oh, almost a decade.
Yes, almost a decade, you can say that. And from the first day I have stepped into St. Giles, and I can say that, yes, there's a lot of stigma around.
There is.
And throughout these 7 years, there are more people coming in. But,
oh, good.
But you can say that stigma still exists because when it comes to mental health, I think there's this understanding in the community that it is to do with only illness. So the common terms which people might use is psycho, unwell, or having a pre-existing diagnosis like schizophrenia or any other condition. But we need to really understand that when we are talking about mental health, it's not just absence or presence of illness. It is complete awareness of one's emotions, being able to tackle with the daily challenges in life, and having productivity. So I think that's what mental health means. It is a whole individual. And when it comes to stigma, I guess it has to change from within. I cannot blame a department or a certain faith group or organization. I think every individual has to change their way of looking at mental health, because as soon as you talk about St. Giles, what comes in mind is mentally unwell. So if that perspective is changed, I think we'll be good to battle.
Wow. Well, thank you so much for sharing that. I've just never heard that before. Do you mind saying that again? You said absence and...
So it's not just absence or presence of a sickness.
Oh, wow.
Yes, it is not that.
Yeah, that's a good way to put it, because, mental health sometimes can just be a, blurb, and everyone's like, what? How do you put that into perspective?
Just like you have a physical health.
Right.
General physical health. So is the mental health.
So is mental health, So working for the St. Giles for the past 7 years, you've probably come across quite a lot of people that have come through, a lot of testimonials of people that have survived or have fought through the challenges that they individually went through. What are some work or some services that are provided at St. Giles for the general public?
So St. Giles is a general psychiatric hospital.
Oh, okay.
So it has an inpatient care, meaning patients who are admitted in the facility that ranges from child cases to old cases. There is no specific age group.
Oh, cool.
So we've had youngest 13, 14-year-old being admitted. Yes.
Oh, that's fantastic.
And the most oldest one would be in their late 70s as well.
Oh, nice.
So that is one, the inpatient care. We have outpatient services that is available from Monday to Friday and even on weekends based on the emergency of the case. So these outpatient cases are looking after forensic department. For example, the individuals who are charged with a criminal act.
Oh yeah, you were just mentioning how you go to court as well. I know we'll talk about it more, but wow.
So we are providing those kind of services. We also have facilities going out of St. Giles Hospital. For example, places like Korovo Health Center, Samambula Health Center, Valalevu Health Center. So this is where our nursing team, along with the doctor assigned, would go and visit the particular health center, and they have the book number of cases to be reviewed.
Oh, wow.
So we are trying to
I think
move across.
Shawal was talking about everyone's trained to a specific.
Yes.
And then you have the professionals.
And we have the professionals going to the areas that I have mentioned.
Wow.
To an extent where even we have a registrar traveling to Lambasa every Friday,
Oh,
so that we
wow.
are covering the booked cases for the Northern Division as well.
Oh.
And we see them in stress ward.
I see. What's the stress ward that you're talking about?
Stress ward, these are the wards that are there in the divisional hospitals.
Okay.
Lambasa, CWM, and currently instead of Lautoka, we're having it in Biasman.
Okay.
So these are the patients who do not have a high risk to others, but they have probably suicidal ideations, or some may have attempted self-harm, and they're needing to be nursed in a closed environment where there's nursing care, there's counseling services, there's doctors reviewing the patient. So that's what I mean when I say stress ward.
Stress ward,
yes. And going
I really love the words you use, because sometimes people are just so brutal with just saying, oh yeah, this one's mentally ill, they go into, but you've really worded in a way where you don't feel like you're, really pointing at the person and calling them,
yes. So I think
words
it's
that we
good
would
to
say.
label it as just stress ward
Yeah.
and not more specific into the
Yes.
illnesses itself.
Okay.
Some of the other services that are
Yes.
provided in St. Giles is AOD counseling. That's
Oh.
alcohol and other drug counseling services.
Oh, that's
So we
important,
have one
yeah.
trained individual who attends to our inpatient, meaning those who are admitted in our
In the
facility,
facility.
and they have a history of substance use, and they need to go through different types of counseling sessions to go through the change model and prepare them before they are released into the community. So that is for the inpatient. There is
Okay.
also outpatient alcohol and
Yeah.
other drugs counseling services. This is
Yes.
for those who are taking substances and they are aware that it's a problem
Yes.
and they are planning to move forward. So from there, the counseling services continues for the alcohol and other drugs. And we also have a community mental health team that consists of a team leader and the nurses and one of the registrars, meaning a medical officer.
Yes.
So they visit patients from Nosori to Suva corridor.
Oh,
So they
that's
go to
good.
their addresses,
Yes.
they review the patients, they get the feedback from the family,
Yes.
if there is any side effects of the medication,
Yeah.
or if they are early onset of
Yes.
having a relapse, meaning they are becoming slight sick
Yes.
but not needing admission, so that the medications can be readjusted, and then to continue the follow-ups
And
that
see.
happens just in their comfortable home environment rather than them coming to the hospital. These services are not meant for all the patients.
Right.
These are for those patients who have elderly parents who cannot bring them to the facility for the reviews,
Okay.
or they don't have that much of mobility, they
Right.
don't have the financial
Financial
support,
support.
they don't have family members to remind them that you need to go for your clinic, because with
Right.
mental health condition comes memory impairment and
Yes.
difficulty to, sometimes they just don't want to come out of that comfort
Yes.
zone. So that is what community mental health is about.
Wow. Well,
Yes.
thank you so much, Dr. Sheetal. We've learned so much just on the services provided, and knowing that everybody, not just in Suva, but everybody across Fiji, that the services are available to them. Well, I hope you've been enjoying just our first talk with Dr. Sheetal Singh from the St. Giles Hospital. We have more right after the break on Your Health Matters. Welcome back to Your Health Matters. I'm your host, Temesia Tuicaumia, and tonight I've just started a great conversation with Dr. Sheetal Singh from the St. Giles Hospital, and she's been there for 7 years. And just before we started this segment, you were talking about a really cool service that you provide using technology. If you don't mind sharing more about that.
Okay, so what happened during COVID?
Yeah.
Because of the restrictions, we were not able to talk to our
That's
patients.
right.
So that time we were not prepared when it comes to technology and
Yes.
all the aspects to be covered, confidentiality and all.
Yeah.
So we used Viber at that time. And just
Really?
Viber video
Yeah, just
calls to
Viber video
review our
calls.
patients.
Oh, wow.
And that was just the beginning few
Okay.
weeks of the COVID crisis and all.
Before the great idea
Yes.
came out.
And then we saw that the turnout was good. I mean, like the follow-ups and all, it was very convenient to the patients. And then later, we started doing telepsychiatry. So this was after one of the workshops in Karnataka, India.
Yes.
And there we received some training and we saw how beneficial it was to the patients and in their own comfort home
Of
style.
homes.
Yes. So we started doing telepsychiatry and still doing it. It's on every Thursday and it's from 10 a.m. to 1 p.m.
Wow.
The bookings come through Singatoka Hospital.
Okay.
So the cases are referred by the nursing stations, by the health centers. So they
Yes.
see the patients and then they refer. They call
Yeah.
and they book with Singatoka Hospital, and then that's how I carry on my telepsychiatry. It's very
Every
interesting.
Thursdays,
Yes,
yeah.
it's very interesting because there you will be able to talk to the patient, even the family members, because all of them cannot come to St. Giles
Right,
Hospital.
not all,
So
yeah.
it creates a very different platform.
You're
but
like filling the gap for
Yes.
families that can't travel,
Yes,
yeah?
yes.
That's really cool, Dr. Sheetal. You've mentioned quite a lot of the services that are provided at the St. Giles Hospital, and I know a lot of people, sometimes with the St. Giles Hospital, they're like, oh no, I'm not that serious. Like, you know, when's a good time to really come in and check in at the hospital, not just to become a patient or just to come and talk, or what's it, how is it available to people, whether they are very serious in their cases or not too serious with their cases, doctor?
I think when it comes to the seriousness,
Yeah.
one might not be aware of how serious problems they are in.
Oh.
So if they are going through some troublesome moments, if they
Yeah.
are emotionally feeling disconnected, they
Yeah.
don't have a person to talk to.
Yeah.
The slightest changes, for example,
Yeah.
a person who is able to sleep for good 8 hours every night is now sleeping only 4 hours. And the next morning is feeling disturbed, not
Yeah.
able to feel the freshness in them because
Yes.
of the reduced in the hours of
Right.
sleep. Or you feel that you're getting more irritable. You're not able to focus at work. You're
Yeah.
feeling socially withdrawn.
Yeah.
The interested activities, meaning the activities that you enjoyed doing before, but
Right.
at present you're not able to enjoy. That means that you're going through some disturbances in your
Yes.
mental health.
Yes.
And I think if you're aware of the slightest changes in your behavior,
Yeah.
you should be able to reach out for help. When it comes to the seriousness of the matter, I think that is for the professionals. So for
Okay.
example, if there's a person A who's having disturbed sleep,
Okay.
and now they're not able to focus at work,
Yes.
they're getting absent from work,
Right.
and they're not able to meet deadlines, those are some of the warning signs which you need to take seriously.
Okay.
So you go to the nearest health center,
Yeah.
you express what you're going through to the medical officer, and then the medical officer calls the psychiatric registrar on call. So there is one doctor who is on call 24 hours for St. Giles Hospital.
Wow.
And we are covering the whole of the nation.
Wow.
Including all the other islands like Kandavu and
Yeah.
all. So we get calls from all other places,
Oh,
from
wow.
so many people calling us. Some are just zone nurses,
Yes.
some are NPs, nursing
Yes.
practitioners, medical officers from other islands as well.
Yes.
And we give them advice accordingly. So if they're coming from northern side of the
Yes.
country, then we refer to ED, emergency department in Lambasa, and
Oh,
then
okay.
so from there they will do the second assessment.
Oh, I
After the
see.
nurse or the medical officer from the
Yes.
periphery, it goes to ED. The registrar in ED will see the
Yes.
patient, and then they will call us again, St. Giles Hospital.
To let you know
then
there's a
that the
case
patient
here.
is here. We have accepted the BP, the heart rate, temperature, everything is okay. What is it that you want us to do for this patient who is maybe clinically depressed?
Okay.
Then we'll do the risk assessment. Can you explore if there's any self-harming ideas, any
Oh.
suicidal thoughts? So based on those risks, we decide whether to admit to Lambasa stress ward.
Okay.
If there is aggression, a person who cannot be nursed from there,
Yes.
then gradually they will be transferred to St. Giles. So we have various way of communicating
Yes.
and planning according to the emergency
Yeah.
or the need, as per the need.
Because otherwise you'll be overwhelmed. There's just like everybody's coming in. You're
Yes.
like, okay, wait, you're this serious, you're that serious. So it's making sure everybody's in the right
Yes.
space. Yeah.
And we are now having Aspen Hospital as well that covers
Wow.
for the Western Division.
Oh,
so
that's
we have a
good.
psychiatric registrar who is working for Aspen. So there is also a professional there who is able to provide support for the
for that
patients
part
in
of the
Western
region.
Division.
Oh,
Yes.
that's fantastic.
Yes.
Sorry, so you said there's Aspen, there's North.
North Lambasa
Lambasa?
Hospital, and we have CWM
Oh,
Hospital.
CWM, so the
Yes,
three main ones.
The three main hospitals.
And then all the other medical centers feed information there.
Yes.
Dr. Sheetal, with patients that are coming in, you were talking about medication, how they have to take medication.
Yes.
What does the medication do for those that are, struggling with mental health illnesses?
So we have medications for different purpose.
Oh.
So, for example, if a person is coming withdrawn, not feeling very worthless, guilt feeling, they are not having the same interest in the activities, so they're clinically showing some signs of depression.
Right.
So if we see that they are not having good coping mechanism, the counseling is not helping, and that's when we introduce a medication that is for depression.
Okay.
So it takes 6 to 8 weeks for the symptoms to go away. So if you look at all the other conditions, the medication takes some time to work.
Right.
So it's not solely depending on the tablet itself, but you have to have the other support around
Wow.
you. Yes.
That's amazing.
Yes.
Wow. Well, thank you so much for answering that, because I think I just never thought about, medication being such a strong use as well in these types of cases. Yeah?
So the medication helps a lot, just like in diabetes.
Yeah.
The sugar goes up. You take your
Right.
medications,
You
the
take your
sugar goes
medication.
down.
Yeah.
You have high BP, you take
Yeah.
your medications, the BP goes down.
Down.
But then you have to take those medications for the rest of your life.
Oh.
For hypertension and diabetes, right?
Yes.
You have to have balanced diet.
Yes.
You have to have a healthy lifestyle,
Yes.
meaning you go for your work, you exercise. Similarly, in mental health, we have
Wow.
medications that try to improve or try to correct
Yes.
the imbalance in the chemicals of our brain.
Wow.
So once the chemical imbalance is getting corrected, the symptoms will also resolve.
I
and,
see.
And this also depends upon when did the first symptom occur.
I see.
So if it has been happening for long and you have not come out to seek for help, then the chance of eliminating each of the symptoms gets a bit less.
Okay.
So the earlier you come to get help,
Yeah.
the
Let's mention
better
that
the
again.
recovery
The earlier you come.
yes, the earlier you come to get help from us,
Yes.
the quicker the recovery is.
Wow.
Yes.
Well, thank you, Dr. Sheetal. I hope you've all been enjoying Dr. Sheetal Singh's insight on mental health and the services provided here in our beautiful country of Fiji. And if you ever need help, make sure to reach out. We'll see you right after the break on Your Health Matters. Welcome back to Your Health Matters. I'm your host, Temesia Tuicaumia, and I'm so sad. I'm having my last segment with Dr. Sheetal Singh. We've talked about some really cool things, and I think a lot of things that a lot of people here in Fiji sometimes can self-diagnose themselves with or have their own ideologies about St. Giles Hospital. And so thank you so much for just really clarifying it and letting us know the services available and opportunities for every Fijian that they can access these services. Dr. Sheetal, I had mentioned to you as well that, sometimes we self-diagnose ourselves. We're like, oh yeah, Google, I have this. What's it like working in that space and making sure to educate misinformation in our communities?
So I think self-diagnosing is something that is common in most of us.
Okay.
And the thing is that when you search about something,
Yes.
there is tons of things that you will come across.
Right.
And sometimes it might create a bit of fear in you and
That is
make
so
make your
true.
symptoms worse.
Yeah.
So if you're going through anxiety
Yeah.
and you are trying to search what exactly I'm going through, so you might think, okay, it's anxiety or PTSD,
Yeah.
post-traumatic stress
Yeah.
disorder, or some other condition, or
Yes.
maybe they might say I have depression or
Yeah.
bipolar. So I think if you're not sure of the diagnosis, you're getting the extra load of stress. That I will be needing tablets now.
You're like,
Exactly.
oh my gosh, I actually have bipolar.
And there are some conditions
Yeah.
that, for example, borderline personality disorder, right?
Yes.
So these are some of the things, if you read upon, you will
Okay.
be scared because you will think that there is nothing much Fiji can provide me
Right.
with. And I think it will just add on to your stress.
Thank you for
add
sharing
on to your
that,
burden.
doctor. Yeah. Wow.
Yeah, I think they need to be aware. It's good to
Yes.
be aware
It's
that
good
there's
to
some
be aware,
problems,
yeah.
and then
But
stepping out
yeah,
is something
and
they need
seeking
to do.
professional
Yes.
support. Dr. Sheetal, you come across a lot of people that need support, and you were talking about the youngest being 13, 14 years old now at the hospital to the oldest being over 70. Um, if someone out there that, in the community would like to get support, how can they reach out for that help? And you had mentioned, it doesn't matter how serious or whatnot. Make sure to call. We have the phone toll free that you can call. If you could just mention that out for the community.
So I think if you're aware that you have some problems and you're struggling with those problems, I suggest you can reach out to the nearest health center first. And then we will be giving the advice to the medical officers that are attending to you. And from there, then we can go ahead with the booking done with us. But St. Giles Hospital is open 24 hours. And
Okay, I did not know that.
Monday to
Wow.
Sunday.
Wow.
And if like we get patients any time of the day.
Any time of the day.
And there is a doctor who is on call. And the
Okay.
doctor is able to attend to the patient.
Are you a doctor that goes on call as
Yes.
well, or do you look after the setting?
No, I do
Oh.
on calls as well.
Oh, okay. So you can meet Dr. Sheetal,
Yeah.
my good friend now. Oh, that's
Yeah.
amazing.
Yeah.
Dr. Sheetal, I just had another question in regards to that for the communities. Sometimes they want to just reach out over that Zoom call that's available, but what are some things that they can do at home from your experience as a doctor that they can start doing just to making sure their mental health, they're being looked after, like Shawal was mentioning positive mental health. And also if you have any really cool stories of people that have fought through their mental health illness and are doing amazing in their communities.
Of course. So
Yeah.
I have seen a lot of patients who have been really low, really
Yeah.
unwell. And with the help of the medications, with the
Yes.
help of the counseling services
Yes.
and the different types of therapies that we are able to provide in the limited resources we have,
Yeah.
they have turned out to be doing really well in the community.
that's so good
They
to
are
hear.
coming from very highly ranked professionals, I would say.
Really? Wow.
And I would not name the universities, but these are lecturers,
Yes.
these are lawyers, and
Yes.
very, very, very educated people.
Wow.
And they're able to have a very well, a very well productive
Yes.
home,
Yes.
work, and their social life as well.
Wow.
So I think having a mental illness does not define a person.
Yeah.
It does not
Good. Thank you
describe
for
a
saying
person.
that.
Yes.
Yeah.
Any individual, they will be able to be performing well in their lives, provided they have the circle, the
Yeah.
support. And some of the basic things which you and I can do in life
Yes.
is having a healthy sleep hygiene, right? Healthy
Ooh,
sleep.
that's a good one.
So, yeah,
Yeah.
these days we are mostly glued to our mobile phones,
Yes.
our laptops and
Oh my
tablets and
gosh,
all.
yeah.
So, one advice is that when we are having light in front of us, it is stopping the chemical released from the brain that allows you to sleep. So, melatonin is something that is released and it helps with the sleep.
I
So, if you are glued
see.
to light, your sleep disturbance is going to occur.
It's
So
gonna be very
simple
high.
things is limited screen
Screen
time
time.
at night, have a lighter dinner, earlier
Wow.
dinner, having a comfortable bedding,
Yes.
comfortable temperature,
Yes.
the noise environment and all. Those things matter. Simple things like warm shower, combing your
Wow.
hair, basic simple
Yeah.
hygiene that would actually show tremendous effect in your sleep. I mean, like
That's
good effects in your
amazing, yeah.
sleep. Yeah. Other things would be avoiding caffeine and energy
Oh,
drinks
yeah.
in the afternoon or evenings. That is something that we do. We love our coffee.
Man, Dr. Sheetal, after you said that, I had to stop taking like energy drinks and taking coffee every
Yes.
morning because like my heart would just like race.
Yes.
Is that an effect from
Yes,
caffeine?
definitely it is.
Oh my
I mean, like,
goodness.
I wouldn't blame you, but our
Yeah,
job,
yeah.
our job requirement is such, yes,
Yeah.
that you have to work extra hours. You have to
Yeah,
stay up.
yeah.
But then this is how the coping mechanism gets worse.
Right.
Today it's coffee.
Yeah.
Tomorrow it could be drugs,
Yes.
alcohol,
Good
and
point.
other things that's
Yeah.
gonna cause more harm than the benefit.
Yeah.
So I think it starts with the slightest coping mechanism,
Yes.
like being dependent on a thing that you
Yes.
take.
Yes.
And then your body starts to depend on other things.
Ooh.
Yes. That is the
That's-
scary bit.
It's scary, yeah.
it
Wow. Well, Dr. Sheetal, I've really enjoyed talking to you and just hearing about the experiences that you've gone through being a doctor at the St. Giles Hospital, and just like how you've all just like evolved with time, and you have that new Zoom call that's available for for your patients. Is there anything that you'd like to stress at this point? I just wanted to give you some time. If there's anything you want to mention, just to the everyday Fijian out there that's listening to you tonight.
I have one thing to say. It's very hard for individuals to understand when exactly the mental health matters or when exactly the problem starts.
Yeah.
Just to educate the listeners for today, that it starts from conception. It starts from the time when a child is conceived in a mother's womb. So you need to respect the complete pregnancy period
Wow.
of an individual with better nutrition, better support, because the mental health of the unborn has started there and then.
Whoa.
So if we contribute towards healthier pregnant women in our community, it's going to mold every individual
In
to
our
appreciate
society.
mental health
Wow.
from that beginning.
Yeah.
So yes, that's when it starts. From the
Wow.
type of food we eat, the type of environment we create for a
Yes.
pregnant woman,
Yeah.
and their support they
Yeah.
get throughout pregnancy
Wow.
till they push their child
Yeah.
and bring them into this world.
World.
So the mental health
Wow.
starts from there and then.
Wow, that's
so
fantastic.
so that's my encouragement,
Thank
that
you.
do not wait
Yeah.
for them to become a teenager, for them to become an adult where they're
Yeah.
able to express that they are
Yeah.
depressed, that they are angry.
from-
It
yeah.
starts from very early age,
Wow.
which is from the time they get conceived.
Wow.
Even when they are, born, they're
Yeah.
crawling,
Yeah.
they're playing,
Yes.
they're not even learned the word mama, papa, dada.
Yeah.
They there and then, whatever they're listening, you
Starts there.
quarreling and having
Yeah.
fights, argument is already having an impact on their mental health. So it starts
Wow.
from the very beginning. It's just like a seed planted,
Yes.
water, nourishment, then the plant grows.
Yes.
And that's how life is when
Yeah.
it comes to mental health and the origin. So I'm
Wow.
just encouraging everyone.
Yeah.
Let's look after our pregnant mothers,
Yes.
and let's support, because when you're supporting, the entire family and community will learn to
Yes.
appreciate mental health better.
Wow.
Thank you so much.
Oh, thank you, Dr. Sheetal. I really appreciate you coming in and sharing that. And you probably hear this all the time, but you're such an inspiring doctor.
Thank
And I'm really
you.
inspired just about your, sometimes you go into a hospital and they're just like, okay, this is what you need to take and whatnot. But hearing you really just share testimonials of, patients that you've gone through, services that you provide, you can really hear your passionate heart for it. So thank you for all you do for Fiji. Fiji's very blessed to have you.
Thank you so much.
Oh, that made me emotional. Well, I hope you've enjoyed tonight's episode with Dr. Sheetal Singh, who shares her heart about the work she does for every Fijian that's watching at home. And we're so grateful to Ministry of Health for also being such a great ministry providing services for our Fijians. That's it for us tonight on Your Health Matters. I'm your host, Temesia Tuicaumia, and we'll see you next week, same time, right here on my TV.